Good morning, everybody. There are some stout people in this room. My thermometer this morning read minus 47 at one point, which I don't know if cars still have block heaters. I've got an indoor garage. I'm very, very fortunate. For those who don't, hopefully you have your cars plugged in and staying warm and all the rest of it. And welcome to the people that are in the room. So we purposefully called this a town hall rather than rounds per se, because we are really hoping to engage folks. And so before I get started, I would like to start by respectfully acknowledging that we are located on Treaty 6 territory, a traditional gathering place for diverse Indigenous peoples, including the Cree, Blackfoot, Métis, Nakota Sioux, Iroquois, Dene, Ojibwe, Saulteaux, Anishinaabe, Inuit, and many others whose histories, languages, and cultures continue to enrich our vibrant community. So first of all, welcome back. Hopefully you all had a wonderful holiday period. I know personally and from speaking to others, January can be a tough month to get through. There is such a thing as January blues. And so I thought that, it would be good for us to be able to start the year with something to look forward to. And so hopefully most of you will remember that through the last probably 4 to 5 months of 2023, we had embarked on our strategic planning process. We held we started off with a number of surveys and, sort of engagement tools and things, and then went on to have a number of in-person workshops, which were amazingly powerful. We had so much information from the surveys that we had done, but then when we had those in-person sessions, just got some outstanding feedback and information and so on. And so we've taken quite a bit of time to put all of that together. First of all, to start off with, there was a core team that was assembled, and that consisted of Dr. Adrian Wegg, who unfortunately couldn't be with us today because he is now in a new leadership role with Alberta Health Services, leading the SCN. So has a meeting this morning. Dr. Karen Doucette, who was our sort of representative for the leadership. Sean McMurtry, who is our representative for the faculty. We had one of our chief residents, Kristen Malloy, who is now on maternity leave. So congratulations to her. And we had Francois Bouman, who of course is representing the administrative staff. So that was the core committee, did a ton of work, had a number of meetings to sort of guide the process. And then guiding us through the process were our two external consultants, Mr. Vic Shuchak and Dale Reeser, who I will just introduce very briefly. So Vic and Dale, both, many of you will know. Vic is president of VisionWorks Consulting Group based in Edmonton, with over 30 years of experience with strategic planning, leadership development, leading organizational change, and organizational development initiatives. He's worked at the U of A for 15 years as senior advisor in leadership and organizational development, well-versed in understanding of post-secondary institutions, and continues to consult to the faculty, supporting several departments and divisions in their strategic planning and leadership development initiatives. Vic is also associate faculty at Royal Roads University within their Master of Leadership Executive Leadership Studies program. And many of you will remember Vic from the old Gold College that was offered in the past. Dale is president of Foreshores Consulting, based in Edmonton for over 10 years. As an employee of the U of A, Dale provided invaluable assistance to many departments, divisions, and institutes. Having since established his consultancy, he now returns to us at the U of A, offering his expertise in facilitating strategic planning and aiding in organizational transformation. His methodology in strategic planning is both effective and consistently replicable providing leaders within the academy and institution the opportunity to concentrate their energies on contributing meaningfully to planning outcomes. So sincerely would like to thank Vic and Dale for guiding us through this process. And so today, we're looking forward to sharing those findings. Now, we have shared the initial plan with our leadership team at the steering committee, and so they are well aware of this. But the idea of today is both to share what this initial draft document looks like, and just so you know, this is not binders and binders of information. The binders are there, but Vic and Dale are looking after that. But really what we'd like to share with you is the two-pager that we've developed as a result of this exercise. So that's sort of setting the context, I hope. And the last thing I'll say is, you know, I've been in this position now, I guess it'll be 3 3/4 of a year. And I really feel that the first little while was important for us in terms of setting out fires with the pandemic, with the massive restructuring we undertook within the university, and a number of other challenges, you know, Connect Care and so on and so forth. And so this has been a real invigoration for me personally, and I hope for the department in terms of a direction to go forward in. Again, keeping in mind, though, strategic plans are a part of what we do. They don't define everything we do. You know, we still have our day-to-day work, our individual sort of areas that we continue to develop and so on. But this gives us a bit of a roadmap in terms of moving the department forward. This is your strategic plan, the department's strategic plan. It's not my plan. It was developed with consultation, engagement, and surveying of all of you. And so hopefully you'll see pieces that you can relate to. Slide. So this is the agenda. Just very quickly, we're going to review obviously the plan and the final output, the process for socializing how we're going to be implementing, and that'll come. And then really the implementation piece will be important to ensure all of you are engaged in that, because what our big ask, and I'll just start off with this, I don't like murder mysteries, we'll just say that we are going to be asking our faculty members to identify themselves in areas that you can relate to and form our task forces accordingly. I'll also commit that the department has identified some resources to help with that implementation. So this is not going to happen off of side of people's desk. We actually have identified some resources that are going to help to lead the work. But what we need from our department members, and that includes our faculty, our staff. I've already had a number of residents volunteer to step forward on these task forces to really give us the ideas to move the objectives forward. So I guess that pretty much covers our desired outcomes. And so I'm now going to hand it over to Vic to really review and prepare for the work ahead.
Yes, thank you. Thank you, Dr. Kassam. Good morning, everybody. Yes, thanks for braving the weather and coming out wherever you're coming to us from and or online. Hope you have a nice big cup of coffee. Today, I think what Dr. Kassam was talking about, it's kind of a celebration, in effect, that we are at a point now where the department core team is pleased, happy, proud to present to the department, to our community, the strategic plan. Get to connect with you at a meaningful level and to circle back with you in terms of what data did we initially get from you, how did that get synthesized, how did that form the plan. So our goal really when we started was to reach out to as broad a scope as we could. We sent out invitations for one-on-ones with Dale and I. We sent out invitations to complete a SurveyMonkey to contribute your ideas and thoughts. We went back and forth in and out of the divisions to iterate the plan. We invited you, I think it was in the summer, to contribute to the objective designs. that would help the goals to achieve what it is that we wanted to achieve. So we're here at this point, and we're happy to present this to you. You can see at the bottom of this slide, construct the plan, present the plan, and move to action. Here we are. Plan is constructed. We're presenting the plan back now to the department community. And as Dr. Kassam is saying, is how might we move this plan into action? There's a tremendous amount of time, effort, work on the entire department's behalf to get to this place to build the plan and to present it to you. And we're looking for contributions from you folks on moving it forward. This is the plan. Dr. Kassam held up the two-pager. This is the two-pager. I'm going to toss to my good colleague Dale Reeser to give us just a brief orientation to the strategic map. Dale has placed in the chat, if you're online, you can click on a PDF there to have this open on another screen if you need to see it bigger. But Dale, walk us through of what this is so we can work with it.
Thank you, Vic, and good morning, everybody. As Vic said, this is the strategy map, and as any good map, it sort of shows the direction, the pathway to the future. Dr. Kassam said a moment ago. Oh, just a comment. There should be a PDF link in the chat at the very top. We put it in there earlier. If you kind of scroll up there, it's the very first thing in the chat. So it is, it's a single page. We, in our strategic planning, we've all been part of those activities where there's several binders and it's easy to get lost. But this here from top down illustrates the pathway forward. And at the very top is the alignment to the organization up to the Faculty of Medicine. And then, so really this strategy needs to support the strategy of the overall arching next level up within the academy and the institution. And then the second are really a little bit of a different approach. And as Vic has described, we work hard to engage your external stakeholders, your colleagues within the department. And this list of 5 items here, the goals, the what the department wants to achieve, is really the voice of the organization. So unlike a traditional strategic planning project where we kind of get together in a room and we say, what do we think we should do? Your core team has worked hard to say, what do our stakeholders need from us? And so these 5 items are the goals for the strategy. Nurture a culture of leadership, develop and strengthen collaborative research networks, enable client-focused departmental administrative processes, enhance position as national leaders in medical education, and finally promote and enhance community connections. Now, a little footnote here, none of these items on this strategy map do all the work. They all sort of need to work as a cohesive whole. And so what does nurture a culture of leadership mean? Well, as we dig deeper into the strategy map, and then on the next section, on the backside of this is the balanced scorecard. It all works together to create a voice of what the department is seeking to achieve. So these are the 5 goals, and underneath of this are the objectives, the how. So that level is the what the department wants to achieve. The next level down is how that's going to happen. What are the high level steps that are going to be taken to achieve this? And we keep going deeper as the strategy unfolds. But the way we read this now is there are 4 columns there: innovation, stakeholder relationship, operational excellence, and benefits to society. So those are the 4 themes. And when we see these objectives, Vic, if you put your cursor, if you would please, by that first top left one there, design and develop a leadership development framework. So the group that's going to work on that, the work team, the action team, they're going to think, what innovative ways can we implement to achieve? And you'll notice there are corresponding colors. That orange is advancing nurture a culture of leadership. So as we look at these, we see that there are two oranges and one that is an orange and a green on the far right. Those are the ones that are advancing that goal of nurture a culture of leadership. So that's how we read this. And members of the core team are going to present on each of these objectives in a couple of moments. But these are the objectives that through careful conversation, going through literally over 1,000 points of input from your colleagues, this is how the core team said, how are we going to achieve these goals with these high level steps? If you downloaded a copy of the PDF and you're wondering, well, what does it mean to design and develop a leadership development framework? There is a definition on the second page, because as I said a moment ago, none of these individual items will do all the work. So this, for some groups at the U of A, some groups use this document as a part of their onboarding process and say, this is the overall direction for the entire workplace that we're sort of putting our shoulder to. Without going through all of them here, if we go down to the purple band, this is people and workplace culture. You'll notice that there's no vertical divisions between these because these are two cross-cutting objectives that support all of the objectives above. And this is what is needed by the colleagues within the Department of Medicine to achieve all of these. So again, just to go back to that design and develop a leadership development framework, in order to achieve that, there's some things that are going to be necessary within the department to sort of support the department in all areas, but also support the implementation of these specific objectives. And these are improve workplace culture and nurture a culture of community. And again, if we take a look at this and say, well, what does improve workplace culture mean? We're going to have some assistance on knowing what that means by taking a look at the second sheet of this. Underneath of that are some definitions, advancing the institution, goals, objectives, people and workplace culture. We talked about those just for a moment. And then we went to the website for the Department of Medicine and we collected the values that are stated there. And values are pretty important. I mean, Vic and I put a lot of time and effort in our professional lives and personal lives thinking about values, working with values. And values are quite important because they are those underpinning beliefs that guide our activities. So I guess in a quick nutshell, a quick overview, this is the strategy map, the roadmap towards the future. And as we move deeper into sort of rolling this out this morning, more of this will continue to make some sense, have some greater clarity. Shall I give a quick orientation then, Vic, to the balanced scorecard? Okay. What we did here down the left-hand column is we simply transposed those themes of innovation, stakeholder relationship, operational excellence, and then the purple band into people and workplace culture. And then we again transposed the strategic objectives from the first sheet we just took a look at, and we inserted them down that second left-hand column and provided a definition. So design and develop a leadership development framework. Your core team defined this as create a structured and comprehensive plan that will describe the ways to cultivate leadership skills in junior leaders and enhance leadership skills for established leaders within the Department of Medicine. So again, we start to see how each of these objectives are going to receive greater clarity, giving implementation work teams opportunity to say, so what is meant by that? And so when I read that, it says create a structured and comprehensive plan. So there's something around design and develop a leadership development framework that really is about planning something. And then we'll notice on the next to the right, there's a column just called A. And a few moments ago, Vic and Norman both mentioned, seeing if people would give their names, give some time. And so Vic will introduce us to a bit of a responsibility matrix, but we're going to put a single name in this column here that's going to kind of take the lead on design and develop a leadership development framework. And then we've got measures and targets. And we've inserted 3 here: leadership development competency needs assessment completed by insert date, an inventory and dissemination of leadership development opportunities compiled by insert date, and finally a framework for developing leaders by insert date. And then 4 columns to the right of that: 24, 25, 26, 27. This is really just for scheduling these. So if you're going to be a part of an implementation work team that works with design and develop a leadership development framework, you'll change that insert date to when you believe, you and your work team believe, that's going to be completed. Again, it's just to kind of give a sense of, are we too heavily front-end loading a strategic plan implementation? Do we have a manageable cadence? And are we putting these items over the 4 years of this strategic plan? So the front side is the strategy map. This is the balanced scorecard, and this gets a lot more detailed here with some of the action steps. And if I can just add a note here that the core team was extraordinarily rigorous in developing all of this. It's with great care and consideration. A strategic strategy and a strategic plan, though, can be fluid. It has to go with the ebb and the flow of the day-to-day workplace. So that's the strategy map. This is the balanced scorecard. And I don't know if we pause here for any questions, or if we just move towards the core team now, having some comments about the specific items here.
Yeah, over to Narman at this point. I think let's get into peeling these back a little bit and inviting the core team to speak to them. So Dr. Kassam, over to you.
Yeah, so thank you. Thanks for that overview, Dale and Vic. And I think when we planned to do this, what I had hoped was we would have each one of those areas under each one of the goals with the objectives underneath presented by a different core team member. But I'm going to take over Adrian's role. He was going to present the first one. So I'll start off with that. And again, as you're listening to this, just think about whether or not this resonates with you. If this is something that you feel strongly about, that you either want to be a part of in terms of a consultant, or if you feel that you want to take a leadership role and actually take accountability for it and step up that way. And we'll talk about how we'll sort of eventually get to the point of getting that matrix filled out in terms of folks that are willing to take accountability and be consultants. I think you can go to the first slide, Vic, with regards to the design and develop leadership framework. Yeah, I think we had actually made additional slides where we broke it up. Do they not have those? They should. So if you go down a bit, whoever's manning the slides, like go to the next couple of slides. I think it should be in there. We did update and separate them out.
I'll get those.
Okay. All right. Well, in the meantime, I will start off with the first one. So if you recall, the first goal, nurturing a culture of leadership. So we had identified 2 objectives, again, from all the surveys and the working groups and the one-on-ones. And those objectives were, number 1, to design and develop a leadership development framework. And so what does this talk about? This is sort of, if you will, even taking an inventory of what's available out there. And both individuals that filled out the surveys and in the working groups, as well as the core team, felt very strongly that leadership development shouldn't wait until individuals are identified for a leadership position or step up for a leadership position. Leadership development needs to start early. And in particular, I really appreciated having the resident perspective on it. Kristen felt very strongly after discussing with the resident team as well, that it needs to start right from our learners to our junior faculty, to mid-career faculty, and all the way up, to identify opportunities for leadership development. And there are a number out there. They're both internal within the institution or the faculty, as well as external, and different opportunities likely fit best at different areas. And so developing that framework, and maybe at the end of it, we come back and say, you know, there is some development that needs to happen. Now, again, most of these objectives, you'll sit back and say, but some of this is already happening. So for example, I'm looking at Vijay across the room here, and he's done a number of, you know, faculty development initiatives where he's developed little seminars and tools. And so it's really about taking some of those, you know, developing an inventory, if you will, new tools if we need them, and then identifying where the gaps are. So that's what this speaks to. And so that's objective number one. And then the other objective that ties into the leadership development, to the culture of leadership, is, if you will, go down, and it's objective number 2, 3, 4, 5, 6. So number 6 there. And again, if these are the PowerPoints, yeah. So who's controlling the slides? Is it Vic or Dale? Vic, if you just go down on the slides a little bit.
I think he's got the
old version.
yeah, and I just sent him the updates.
Okay, that's fine. We'll just deal with it the way it is.
Okay,
So the objective, the second objective that speaks to this is, as you can see here, design and develop and offer a process for evaluating leadership contributions via feedback and feed-forward mechanisms. So there you know, are a number of leadership positions that get identified, both on the university side as well as on the AHS side, and potentially in other areas. But there isn't a formal mechanism to give people feedback in terms of how they're doing. You know, we do this sort of informal annual reports where there's some of that happens, but there isn't really a formal way to evaluate, if you will, or assess how we're doing as leaders. And so that's what this speaks to. And that's, you know, around, that's why it fits under operational excellence, is because if we want a high functioning organization, we have leaders in place that are effective, that are able to undertake, you know, the objectives that we want them to fulfill. Then we need to give them feedback whether or not they're successful, and not just wait until the end of their term, whether it's 3 years or 5 years or whatever, but actually have a framework in place in order to have that ongoing quality improvement or quality assurance, if you will, of their leadership performance. So that goal fits under objective 1 and objective 6. So that's the 2 there. I'm now going to hand it over to Karen, who's going to sort of outline, it didn't show up that well on the slides, but it's actually green. And it's the goal around developing and strengthening collaborative research networks. So there's 2 objectives there. If you need the paper version, they're here.
Yeah, I just have it on my phone,
Okay.
I think, because yeah. Pardon? No, I think I'm okay, Andrea, thanks. So yeah, just winging it a little bit. We didn't review all the slides and process. So yeah, so in the green, which as Norman said, doesn't show up great, but you know, develop and strengthen collaborative research networks was one of the goals. And within that, the 2 objectives. So the first, leverage current and emerging technology to enhance research. So this again, you know, a lot of the survey input and the table discussion brought out that there's a strong feeling that obviously the department has a lot of strengths in terms of research groups, utilizing technology, cutting edge work, but that we could do more. A lot of this is really about, you know, how do we continue to push? How do we raise our profile in areas? How do we continue to be leaders and ensure that we're always on the cutting edge? So a lot of the feedback came around AI, but the discussion was really, you know, what else? There's always new technologies, there's new methodologies, there's discussion around the Connect Care data that is increasingly available, and how we can really systematically work to ensure that we are optimizing, that we're remaining leaders in this, in these areas as they emerge. So when we look at the objective definition, embrace innovative methodologies, latest technologies, develop human capital, and ensure research has the highest impact. So again, some of the metrics, what are we looking at? The traditional metrics, grants, team grants, and output, but also are there other metrics that we really should be looking at here? So that was objective 2. And then the other objective that links under this is objective number 5, which relates as well to our stakeholder relationships. So create a culture of engagement and collaboration between and amongst the divisions. So again, I think there's many research groups, and as I'm looking around the room, I see people who are involved in collaborative research groups that are cross-cutting across our divisions in the department. But again, a lot of the feedback and discussion is that, we also routinely hear that we don't, a lot of people aren't aware what is going on, in another division, or if I'm looking for, a collaborator that has this skill, or that I don't necessarily know that it might be, 2 floors up where it's much warmer than in my office, but and go looking elsewhere. So, are there missed opportunities, and what are the ways that we can build collaboration amongst our divisions? And again, as Vic and Dale were talking about earlier, this also links, all of these objectives links to each other and links to our general, how do we enhance the culture? How do we bring the department together more so that we know about each other, we support each other, and we share opportunities for collaboration. So I think that's all I had to say on those 2, and I'll hand it back to Norman to lead us.
Thank you. Yeah, okay. So Kristen was supposed to present the next one, but she is obviously at home, warm with her baby. This one was a really difficult one for us. So this was around medical education. So you see the goal here, and we heard it across the board, which was to, become leaders, to be leaders in medical education. And that's such a broad goal. I mean, yes, of course we should be leaders in medical education. Many people, however, felt very strongly that we actually are leaders in medical education. When you take CBD as an example, I mean, we are one of the institutions that's actually leading the way in terms of CBD, both implementation as well as evaluation. So really what came out of that was, rather than focusing on sort of broad areas, that we really wanted to reinforce that we want to enhance our position as leaders. So how do we do that? And just like Karen talked about with research, there is also a sense in medical education within the department that there's a bunch of really cool things happening, but we don't share them. And so how do we go about doing that? So the way this objective read was to develop and disseminate innovations in medical education. Vic, I don't know if you realize or not, you're on which slide you're on. If you want to go back to the scorecard, and we can just stay on there and talk about that. So that's objective number 3. So develop and disseminate and implement innovations in medical education. And what that really talks about is creating and sharing new and improved educational methods. And, purposefully, I think we did not want to just focus on CBD. There has been so much focus on CBD over the past few years. And we wanted to talk about new tools in general. I mean, right now, the vogue thing seems to be CBD, but there's other areas that really are untapped, SIM, other tools, I guess, and practices to enhance the quality and effectiveness of medical training and education that's delivered within the Department of Medicine. And that spans across the continuum of education, undergraduate, postgraduate, CME and so on. So that's really what this one was speaking to. Yeah, so I think that's all I will say about that. And I'm going to now hand it over to Sean to talk about our goal number, I guess it would be 5, right? To promote and enhance community connections.
Okay.
Take this?
No, that's fine. No, thank you very much. So the modern organization stewards its relationships with external stakeholders in a structured way. The jargon in industry is client relationship management. But what we envision is a way to manage our relationships with external stakeholders that is intentional, that's aligned with our organization's goals or objectives, is structured, and is independent of any one individual. So if somebody moves on from the organization, that relationship is not lost. One can envision many components of how this might look. Like, for example, a process would involve thinking very carefully about what we would like to achieve when working with the public. Obvious domains are the pillars of the things that we do, such as patient education, enrollment of patients in research, enrollment in patients in the care that we give and responding to their concerns, and then perhaps also offering them opportunities to give back somehow. And that could be philanthropy, that could be education of other people, it could be all kinds of things. The possibilities are endless, but it should be aligned with what we wish to achieve. There should be also a process of inventorying who's out there and wants to engage with us and making some priorities. Abstracting from that, the segments of different kinds of people that we interact with, people or organizations, I should say, and then building behind that an infrastructure to manage and steward those relationships in a structured way so that we can make the most of them. The idea is that we would, in the end, by engaging this way, be more effective of all the things that we set out to do, whether it's education, enrollment of patients in research, impacting the public and serving them the best we can. And so that's the main idea, and happy to take questions later if there are any. Thank you.
Francois, I'm just going to hand it over to you to cover the next one.
Thank you, Dr. Kassam. So the next one is, the next objective is objective 7, and it falls under the goal of enabling client-focused department administrative processes. And so the strategic objective within that is to develop department-wide shared expectations for administrative services to support faculty. And as Dr. Kassam mentioned at the start of the presentation, there have been a lot of significant changes in administrative support at the university over the last few years, with the SET initiative, the Service Excellence Transformation Initiative, and now being followed by CASIP, the Continuous Administrative Services Improvement Program, which has about 70 some initiatives underway that will be completed within the next anywhere from 6 months to 4 years. So things have changed a lot, and things continue to change with respect to what the expectations are, both at the university level and then within the department level. So really, this objective is one that would look to ensure that all members of the department, staff, faculty, learners, everyone included, has a common understanding of what the expectations are from administrative services in terms of the support that would be provided to faculty members in particular, but to the rest of the department as well. And so I think this will be an interesting working group in many respects in terms of trying to ensure, because currently I would suggest that there is a very wide range of expectations simply based on the transitions that we have undertaken both at an institutional level and at a department level. So this will help clarify what the expectations of administrative services are within the department, and will help us then align our resources and work expectations internally to provide the support that's required. think that's about it, Dr. Kassam.
Thank you.
Thanks.
Okay, so now the purple bands, I guess. So just to very quickly touch upon these. You know, this really speaks to the reason we want to get up in -47 weather and come to work, which is workplace culture, right? Well, and you know, I had a tough time getting my head around this one because, you know, when we talk about improving workplace culture, there is this intonation there that there's a problem with the culture. And there may or may not be, but there's no question that we need to strive towards continually improving the culture. And there's various ways of doing that. And that's where the definition comes in, you know, whether or not, and to me, I think most of you who know me know that I feel very strongly that there needs to be trust in leadership, there needs to be transparency, and there needs to be opportunities that people feel that they're in an organization that is going to look after them, that is going to listen to them, that's going to continue to ensure that they have the opportunity to be the best that they can be. And you know, there's lots in the literature about this in terms of, you know, where does this fit best? Does it fit within the smaller unit of, you know, whether it's your super specialty or your division or your department or the faculty or what have you? But regardless of where it fits, we need to define it in terms of what is it that's important to people in order to feel that they are part of that unit. And so that's what this objective speaks to. And then the last one is nurturing a culture of community. So we are the largest department in this institution. You know, in terms of whether you look at on the academic side or the clinical side, we are the largest department. And so how do we nurture that sense of community? And, you know, there were lots and lots of great ideas thrown out there, from, you know, lounges to regular, you know, venues to have gatherings and something to help us connect. And this past 3.5 years has really been a struggle in terms of finding ways for us to connect as a community and feel, you know, like we are one collective through Zoom and through various other initiatives that we've tried to bring on. So how do we continue building on that? And so that's what that objective speaks to. So I think that we have pretty much defined those areas. Vic, Dale, do you have anything to add to anything, you know, that's been outlined so far? Nope, you're on mute. I don't know if you're, oh, there we go.
No, actually, that's well said, and a good overview of the objectives with the definitions. And hopefully that's enough for folks to start noodling through. Did any of those objectives catch your attention and say, you know, I'd like to spend some time working on that one on behalf of the department? And remember, we started, you know, the session off. This is a plan that goes over a number of years. So it's, you know, if we're looking for people to come alongside some of these objectives, it doesn't mean that these have to be done by June of this year. It can, and we've left those dates wide open for any task force, objective task force teams that want to work on these to define what makes sense for the iteration of these things. So that's all I wanted to add there.
All right. Are there any more slides to share, Vic, or is this now oh, right, Racy,
Yes.
of course.
Yes, so we've gone through this. So we're Dr. Kassam is saying, think about these objectives as we've gone through them. Any catch your attention? What we're looking for, Dale talked about that one column that's in the balanced scorecard that just has an A in it. That's that second line here in blue, accountable. And what RACI format is that we're presenting to you here, you know, a process planning model is the accountable person kind of is the lead that would head up, that would spearhead and lead that particular objective. And that's typically one person to take that on. If we have 4 or 5 A's, then it's like, who do we go to do everything from pulling the team together to the mechanics of the team to making sure that we're on track, those kinds of things. So we're looking for, in particular, a person or, you know, a couple of people to step in to say, you know, I'd like to take an A, and then we can land who that accountable person would be. We're also looking for R's. So that's what's called responsible. And an R are multiple people that would take on tasks within that particular objective. So one A that's a lead, could be multiple R's that say, I'd like to come alongside and work on that task force team. That one's got my energy and I'd like to work on that with you. Consulted is, you know, just keep me in the loop and check in with me, and it's a backwards and forwards thing. Here's what we're thinking, here's some ideas. So it's kind of more of a tangential relationship. And an I is just keep me informed, send me some emails. So we're not really looking for C's and I's to the extent that we're really at this point looking for an accountable person and a series of R's that would take lead on those particular objectives. So at this point, I'll stop sharing this. I'll move back to the objective, the balanced scorecard, so that you can have it again. If you've downloaded it, great. You'll have it in front of you, but we'd like to hear now from you folks on your commentary on this. And if there's anyone in particular that would just say, you know, I'd like to play along on one of these objective task force teams in the future as we launch it.
And in case you missed it at the beginning, I will just reiterate that I recognize people have a ton of things on their desks right now. And so as a department, we are committing that we have identified some resources to help us along. So, you know, as an accountable, it's not that you would be expected to sort of, you know, gather the troops and get all the things done, and all. We will have a strategic implementation lead that will guide through all of this. And it's really what we're looking for is your ideas and your energy and how to move these objectives that you have identified forward in a meaningful way towards, you know, our long-term plan and continuing to improve our department as a whole, and hopefully invigorate the department in terms of, you know, great things to look forward to. All right, any questions, any volunteers, any, oh, and by the way, if you're not wanting to, you know, sort of, as I've learned, many of us are sort of introverted, don't necessarily, you know, need some time to absorb the material, to absorb what's been said, and then, you know, have an opportunity to provide feedback or what have you. So, you know, please don't hesitate to reach out. My email is always available, and I'm looking forward to hearing from many of you, both in terms of feedback of what you think of the strategic plan and the 2-pager, the goals and objectives. Do they resonate? Did we miss something big that, you know, maybe we should consider? And that's why it's got the draft watermark still on it, because we're still open to ideas that maybe we missed something in those. What did you say, Dale? Almost 10,000 lines of feedback that you received. Maybe we missed something there that, you know, that might speak to the larger department. And where do you see yourself sort of aligning with this? Ron.
Thanks, Norman, and everybody. I'm not volunteering. I'm trying to. No, you talked about missing things, and I was a bit late in the presentation, so you may have mentioned this, but you mentioned that the department is the biggest department in this institution. And I think it would, you know, it surprises me that, you know, the research, the education, and the clinical work that we do to me, it just makes sense that it should be recognized and acknowledged. I think within the system, in a broader sense, it's not being recognized to the extent that it should. And so has advocacy been included into the strategic plan? Because I think we're working in an environment now where if you don't stand up for yourself and
Yeah.
promote what you're doing to all levels of the system, you basically get ignored. And I think medicine, both general, both academic and community medicine, both subspecialty and generalist, is all being kind of ignored and looked over in the current situation.
Yeah, I couldn't agree with you more. And I think, Sean, feel free to jump in, but I really think that that's where that, do you want to go to the other, the strategy map, please, Vic, just for a second? Yeah. That's where promote and enhance community connections, I think, spoke to us with regards, because we did hear this repeatedly from our, our department members, right? That COVID is a great example of it, where, let's face it, we carried 85–90% of the burden, and yet, whether it's pulmonary medicine, ID, whatever area stepped in, all the subspecialists that stepped in to look after those COVID patients. You don't hear that in the media. And how do we penetrate that message through to the community? And I think that's what I'm looking forward to, that task group sort of figuring out and talking about how to promote that. I don't have all the answers by any means, nor do I think the core group felt that they had the answer. And that's why we thought this was an important area to recognize. And I think it fits very nicely in there. So I think you kind of did just volunteer yourself. I'm kidding. No, but yeah, I think that's just so important that we do need to have that message out there, right? Will this document be sent out? Yep. So not only will it be sent out, we are going to, you'll see on our website, there is a link that is very old. It's from our original strategic plan from 2014. So within the next week or so, we wanted to present this to the group first, both the leadership group as well as our department members, before we put it out for general consumption. So that page is going to be updated, and then we'll eventually follow up with a memo to sort of summarize, as well as a recording of this presentation on that page. Okay, Tom, yeah, the PDF would be helpful. Any other questions, either in the room or online? It's a lot of information. I appreciate that. Vijay?
I'll just ask this question because there's probably someone in the 117 participants who might be thinking it. We do have a lot of work to do already. How will you as chair recognize contributing to this, which is still going to be off the side of our desks since we all are already working from over
yeah. No, that's a really, really important point. I mean, this is an important endeavor, right? And so I think it does need to have that recognition that this is happening. And whatever it takes, we have, some capacity to allow people to take this on. But again, what I'll say is, and you and I have had this discussion before, it's like many other areas where I don't think that we should be using physician time to do sort of administrative tasks, right? And so what I will commit is, and Francois and I will both commit, that we have identified resources, whether it's implementation, project manager, administrative support, whatever resources are needed towards ensuring that this plan continues to move forward. Because now is really the important work that's going to start. And then as for individuals, if there's an area, if somebody comes up with this grand plan of we need to develop this sort of tool or whatever, and it fits within their job description, we can identify and take pieces of, you know, their job description to allow them time to do that. Absolutely. I am committed to that. Okay, well, I don't want to belabor this further. So first of all, I'll just ask my core team members, is there anything else that we want to add to what's been said or? Okay. So, and then Vic and Dale, anything else you would like to add before we wrap up?
Thanks, Norman. Yes, first of all, thanks everybody. And second, absolutely, this is a lot to take in. I mean, it's the marathon effect of implementing these kinds of things where this core team has been working intimately with all of these data bits for months and months. You folks are now seeing the output of it. And so as Dr. Kassam offered, you've seen the PDF link is in the chat. It'll be on the website. It'll be disseminated to you in other ways. Please review it and consider getting back to, I think Dr. Kassam suggested, send her an email or even one of the core team members and say, I'm interested in learning more about a particular objective. And I might even take an A or an R on that particular one. So this will be open beyond this particular session so that we get the, you know, a robust activity for each one of these objectives. That's all I wanted to add to that.
All right, well, with that, I just want to take this opportunity to once again thank the core team members, thank Vic and Dale, and in particular, thank all of our department members, as well as our staff and learners for the time that you've taken in putting this forward. And I was just asked to make an announcement. We have our Medical Jeopardy rounds on February 2nd. And so if your unit or your area or your division wants some bragging rights, there will be a call out next week for participants. So please volunteer if you will, your group. If you want to volunteer other people, you can. So yeah, look forward to that. Please stay warm, stay safe, and thanks everybody. I'm really looking forward to getting your feedback on this morning's rounds. So have a great weekend.